Hello, today I'm going to be talking to you about some toilet training tips for little ones. There's a bit of a trend going around that there's a possibility that you can train a baby to be toilet trained from a very young age. And in fact, my mother even told me that I was toilet trained from 9 months, and I never believed her, but I am doing some reading on it and seeing that culturally over in some other countries like China and Africa, there is some cueing done to children, babies, when they're about to do a wee. There's a little whistling noise made or something that's doing some cognitive behavioural training. But I feel like I want to say to you that sometimes the evidence is saying that children are actually often much slower to train if you start too young. And my recommendation is that you start around 2 years of age. It's important to that they recognise the signs of what wees and poos are. Just like other milestones, they'll be ready at different times. And don't try and compete with your friends or perhaps what your mum may have said to you about your siblings or yourself. Each child is an individual, and really respect that and make sure that they are not being pushed too early to do something that really is just beyond their ability at that time. Also accept the situation in your life. If you're working full time, you're not necessarily going to be able to be there constantly to give those consistent reminders. If a child is at childcare, then if you would like the childcarer to give some cues and start to do some potty training, then try and link in together so you've got consistent messages at home and at childcare. But if you're not there to be prompting and to be helpful and guiding and helping with their clothes changing and helping with all of the cues that you've decided are going to work for your child, then it's probably better to wait until you have an opportunity, such as with a holiday break. And particularly it's important to wait till it's spring or summer, where the warmer months you're not trying to take off multiple layers of clothing. A critical message is to stay calm. Don't ask every 5 minutes, do they need to go to the toilet? Can they even feel a message that they have a wee or a poo there? And I do teach children that knocking at the back door, farts or fluffs, that they can feel maybe a gripey tummy, are poo messages that they need to answer. So if they try and go without any of those sort of consistent messages and understanding what they're listening to, you really might be just catching the wee rather than them actually understanding there's a link between what they can feel, what their body message is saying, and what is going to happen if they go and sit on that little potty. Parents need to provide direction, motivation and reinforcement, but definitely no coercion. It's always important, no fights around toilets and wees and poos. Make sure that you're very, very careful about not losing your temper around anything to do with bladder or bowel. It's definitely possible to use rewards, and children do respond very nicely to stickers, and you know, if you're not adverse to giving them the occasional lolly about getting a successful poo in the toilet, then that's fine. Signs that they are ready: they can imitate your behaviour, they express interest in toilet and follow you into the bathroom, they can walk and sit down, they can indicate that they need to go, and they take their clothes on and off. Be prepared to take a break if it's not going very well. You know, it's no point in pushing this on and on and on if it's just causing arguments and unhappiness. So 1 month in the calendar of a 2-year-old can be the equivalent of about 6 months maturation and development of a 5-year-old. So don't hesitate to just call it off. And particularly if they're sick, or you've got to move house, or there's been a relative who's been unwell or passed away, that's never a good time to try and continue on with toilet training. Just a final note, just remember that 67% of bladder issues can be caused by constipation. And if you push toilet training too early and children start to withhold and not go and answer their poo message, and they get withholding behaviours which can lead to constipation, this can lead to just a much more prolonged, drawn out toilet training episode. So please make sure you look at the cues, look at your child as an individual. Don't compare them to all the children at mother's group or either other siblings they may have. Be patient, be calm, and seek help if you're having any trouble. Pelvic health physiotherapists not only assist with toilet training but troubleshooting any problems, and sometimes when they're very little, at 2 years of age, it's not even necessary for the child to come in. It might be that you have a telephone consult or a telehealth consult with the parents, the mother and the father, or the father, to actually guide them as to how to start. Sometimes they just don't know what to do. So good luck with toilet training, and next time we're going to talk about some problems that happen with children, such as daytime and nighttime wetting, encoparesis, which is now called fecal incontinence, and bedwetting. So see you later.